The idea of a heart failure clinic isn't something new. It's something that's existed in other care groups in other parts of the country. It's bringing a person in, gaining an understanding of their illness, going over what the causes of their illness are with the patient, making sure that they understand their medicines, making sure that they understand their nutrition.
When they come into the heart failure clinic at first, what we do is we look at their history, we look at how they're being treated, who's treating them, we look at what medications they're on, we ask them their compliance issues, are they weighing themselves daily, how are they eating, are they keeping a low salt restricted diet, a sodium restricted diet, are they watching their fluid intake. We ask them if they're taking their medications. We look at their medications, make sure that per the heart failure guidelines with the American Heart Association that they're on the right track, that they're on the right medications, on the right doses. And we just work together with the referring cardiologist to make sure that the patients are up to standards with their care.
Heart failure is a medical condition that can be caused by a number of different things. But the net effect of heart failure is that the heart is unable to meet the physical demands of the body. The heart's a pump, and it has to circulate blood to the body. And if it cannot do that, then unfortunately patients can develop a variety of different symptoms. Luckily, it's something that's well managed, so somebody who's on appropriate medicines can do quite well.
And eventually what we want to do is make it more of an acute care clinic for patients that need an extra monitoring for a day. Say they go into their physician's office and they're short of breath, and the cardiologist feels that maybe they just need an extra Lasix and monitored for a little while. That's what we're here for. They can come in, we give them their medications that they need, we can monitor them on our heart monitors, EKG, all day. They could sit and wait, we can monitor their diuresis and get them stable, and then just keep seeing them however often they need to make sure that we can keep them out of the hospital.
The other thing that goes along with heart failure is that certainly we know that non-medical therapy amounts to better care for the patient. So proper education about diet, nutrition, exercise, understanding what the gaps are and what a patient understands about his or her own heart failure illness, and addressing those gaps. If it's a family member who can look in on the patient, or frequent office visits, patients stand to do very well when they're optimally managed.
It's an additional support for the patient. It's additional support if they're acute. Rather than going to the emergency room, it's an additional support for education. Lots of times the doctors are busy. They don't have an hour and a half time to sit there and spend talking to the patients on sodium restriction. What does it mean? Going over labels on food. It's very time consuming. So what we offer here is that time to be able to spend for the patient. Our first visits are an hour and a half visit, so it's pretty extensive information. Our overall goal is to keep our patients healthier, longer, out of the hospital.